medications as prescribed has been identified as a significant problem in HIV and AIDS management, resulting in viral suppression failure. Good evening, welcome back to DDM Health News Updates on our program, Your Health, Your World. As usual, for reminders that you subscribe to our YouTube channel, that is Diaspora Digital Media, so you don't miss all these news. Well, eye specialists have given reasons why babies can be born with cataracts or develop the condition, because many babies today are being born with cataract. You might ask why. Well, the ophthalmologist said pregnant women with uncontrolled diabetes and with other metabolic diseases may give birth to babies with cataracts, though there are other causes of congenital cataract in children. The experts say it was important for pregnant women to have other good antenatal care to reduce the risk of pregnancy complications that could affect the eyes of their babies when they are born. Besides diabetes in pregnancy, the ophthalmologist also disclosed that certain infections in pregnancy, like the rubella, that is German measles, can lead to a woman giving birth to a child with cataract, while advising teenage girls to go for rubella vaccine. Please take notes. They noted that cataracts in children could either be by birth, that is congenital, or acquired after birth, warning that an injury to the eye could cause cataract in children. So please, often know the way your children play. Often take notice of the injuries in their eyes too. However, the physician who spoke during an inclusive interview with DDM How to Eye said it is not all cataracts in babies and children that have the known cause. Of course, someone might develop it at any time. Well, World Health Organization, popularly as WHO, says a cataract is a clouding of the lenses in the eyes that normally affects vision, stressing that cataract is the most common cause of blindness and visual impairment often related to aging. Of course, you can see a young person being blind. The Global Health Body, however, said occasionally children are born with the condition, or a cataract may develop following eye injury or as a result of inflammation or other diseases such as glaucoma and diabetes. Sometimes the development of cataracts is linked to steroid use, or it may develop after exposure of some types of radiation. Speaking with our correspondent, a pediatric ophthalmologist, Dr. Halima Alimi, also disclosed that some cataracts in children could also be hereditary, assuring that children with significant cataracts could be effectively treated by surgery. So there is hope. The eye expert, who is the executive director, Restore Foundation for Child Sight, a non-government organization that advocates for improved eye care for children, said parents should ensure that their babies go for routine eye checks for after 6 months of birth to detect the condition early before it negatively impacts on the overall growth and development of the child. Giving insights into why children also suffer from cataract like older people, Alima explained why children suffer cataracts is because of the variety of things that potentially upset the clarity of the lenses of a child's eye. And so we have said that it can be congenital or acquired. Congenital means that is from mother to child, or it can be acquired after being born. So part of the congenital causes of cataracts are children whose mothers suffer certain infections while they are pregnant with them, which we can call intrauterine infections. Yeah, some infections like that. Most of them are viruses also. And so there are a host of diseases that pregnant mothers can have, which can lead to that. Top on the list is something called rubella, like I mentioned earlier, that is German measles. It's a sort of measles, but a little bit different from the cochlear measles that is known. So it is caused by the rubella virus. You understand? So when a pregnant woman is affected by German measles, the virus will go ahead to cross the placenta and infect the baby depending on the stage of the pregnancy at which it infects the baby. because the time determines if it is in the early stage of the pregnancy when the eyes are still developing. It can cause congenital cataracts as well as other problems that the child may be born with. So, this is one of the most common causes of infected cataracts in children born with six. You might be asking how. Please, if you're pregnant, take good care of yourself. And then also children whose mothers have certain metabolic diseases, such as uncontrolled diabetes, the children themselves, if they are born diabetic, and other metabolic diseases can cause cataract as well. According to an international non-governmental organization that works with partners in developing countries to treat and prevent avoidable blindness, Sight Savers, cataracts are one of the leading causes of visual impairment and blindness in children. I hope you don't want your child to get blind. Well, Alimi also pointed out that there are a variety of other causes of cataracts in children that are not congenital but acquired. Things like injury. Yeah, we all know that children can suffer eye injury from moderate to severe. That is why I say, whenever your child have an injury on the eyes, don't take it for granted. Don't say maybe it's just a minor injury, it might go. No, it might affect your child's eye. It might lead to blindness and other kind of eye problems. I'm sure you don't want to have your child being blind. A child you've gone with sight being very well and you want the child to be blind? Please don't take that risk, okay? Don't at all. Your health matters often. So, if an injury is severe enough, it can result in cataract. Just having an injury, an ordinary, you can call it ordinary. Yes, ordinary injury. Injury is the cause of cataracts occurring in one eye in children. So, inflammation inside the eye can lead to cataract in children if not properly handled. That is why I said, please handle your child well. That is why we discourage self-medication also. The things you put in your child's eye determine. The ophthalmologist also said genetically inherited diseases and indiscriminate use of steroid can cause cataract in children. On signs of cataracts in children, anemia despite delayed milestones such as sitting, such as social smiling, walking, and standing are in some of the early indications, urging parents to establish the habit of routine and check-up for their children. According to her, squinting during bright lights, a white dot with the eye, abnormal movements of the eye, not focusing when looking, and squinting the eyelid when there is sunlight are also some of the signs of cataracts in children. You can imagine your child is seeing a sun and your child will be doing like this. And you can imagine such a thing. Your child will be like, Mommy, I cannot see, Daddy, I cannot see very well. Don't take that for a joke. It's a sign. It's a symptom. Maybe whenever the babe gets brighter, the child finds it difficult to look. Yet is not albinism. Yet the child is not an albino and such thing does not occur. The child is well and well normal. So, whereby the child takes such an art, don't take it for a joke. Maybe stop looking like those. No, don't take it for a joke. Your child health matters. I wouldn't want your child to get fly. So please, take those things serious. When I mean serious, I mean very, very serious. Yes. Commenting on the treatment, the eye specialist said cataract, when they are significant, are treated surgically. That's the only solution to remove that. Adding also that visual rehabilitation for the children after the surgery will enable them to know how to use their spectacles and how to maintain good eyesight. So sometimes you see children wearing spectacles. Those things also help to normalize their eyesight. She says cataract in children could be prevented through immunization in pregnancy. That is why we advise optimal antenatal care, prevention of injury, avoidance of drug abuse, and vaccination of teenage girls against rubella. Please take note of all this. Also speaking, a consultant ophthalmic surgeon, Dr. Folashade Fasina, told DDM Housewives that cataracts is the most common cause of blindness in Nigeria. Note that cataract is the most common cause of blindness in Nigeria. So don't take that for a joke. Don't allow your child to have cataract. The ophthalmologist disclosed that cataracts is treated by the removal of the cloudy lenses, adding that this is replaced with a clear artificial lens. She shared that the removal can only be done through surgery. That is the only solution. Though, Fasina explained that there are various methods of removal, but all are surgical. Get that? All are surgical. Diagnosis is made when a doctor and eye specialist examines and carries out some tests on the patient complaining of blood or vision. Cataract is treated by an ophthalmologist who performs surgery on the eye. When the cataract is still small, vision can be improved with prescribed glasses, but the definitive treatment is surgery. Well, in a 2021 study published in Science Daily, researchers from Denmark found that mothers who have diabetes before or during their pregnancy are more likely to have children who go on to develop eye problems. So check your sugar often. The researchers analyzed the associations between maternal diabetes before or during pregnancy and the risk of eye refractive error, conditions in which there is a failure of the eye to properly focus image on the retina. So they advise that early screening for eye disorders in the children of mothers with diabetes may play an important role in maintaining good eyesight. So remember, you can risk your child if you have glaucoma, number 1, diabetes, number 2. So these two things matters when you are pregnant. You don't just go for antenatal for going sake. All these things matter. That is why we advise if you're pregnant from the first trimester, second trimester, and third trimester, try to visit your doctor. Go for checkup. Go for examination. Complain. Bring out the things in you. So be open to your doctor, to your specialist. Be open to them because they will help you. Your child's health matters no matter what. So in order not to endanger your child, don't miss your antenatal clicks and don't take your child injury as a joke. So always focus on your health because your health is your wealth. Well, with this, we come to the conclusion of our report today on your health, your wealth. Please do ensure to click on the like button, share, comment, and subscribe to our YouTube channel. That is Diaspora Digital Media, so you don't miss this quite exclusive information on your health. Until I come your way again, I am Nenya Nizine. Thanks for watching. You have a wonderful and beautiful day ahead. Bye for now. Billionaire philanthropist Bill Gates and Nigerian business magnate Aliko Dangote have emphasized the importance of innovation and partnership in driving health. In collaboration with Ugoedi Joma Wokoma donated sanitary pads to over 500 students in Cooperative College in Ohaji, Ebema local government area of Imo State. Their medications as prescribed has been identified as a significant problem in HIV and AIDS management, resulting in viral suppression failure, drug